Welcome everyone to this CGHE webinar on protecting newborns, empowering communities, which will be a spotlight on hepatitis B birth dose with a focus on Africa. My name is Dr. Jibril Ndao. I am the Director of Research for the Center for Operational Research on Hepatitis B at the Coalition for Global Hepatitis Elimination. It's my pleasure to welcome our fantastic panelists and all of you audiences to this webinar, which marks part of our commemoration of World Hepatitis Day 2025. Quincy, yes, thank you. Just before we start, a few housekeeping rules to bear in mind. You can submit your questions in the Q&A function. We will try to respond to as many of the questions there, but some of the important questions we will discuss at the end during the Q&A and discussion session. This webinar will be recorded and will be posted on globalhep.org along with all the slide presentations. You can find the biographies of the speakers under the resources tab icon, which is at the bottom of your Zoom screen. And you can stay up to date on other upcoming webinars hosted by the coalition by signing up to our Coalition for Global Hepatitis Elimination newsletter. So briefly, here is where you can find all the materials that will be posted at the end of the webinar. It will mainly be the recordings from this webinar and the presentation slide deck. So you do not have to take detailed notes of the slides. These will all become available. You can use this QR code to scan for easier access, or just go to globalhep.org. Now, this is an abbreviation of our agenda for today. We would start with 7 presentations from CSOs coming from 6 African countries. This would be followed by a panel discussion with perspectives from our partners from Gavi, from PATH, and from the Center for International Health, Education, and Biosecurity in Zambia. We will then have a brief session on Q&A and discussions before we wrap up today's. And to get us started today, I'll invite the Director of the Coalition for Global Hepatitis Elimination, Dr. John Ward, to give a brief remark. Unfortunately, John cannot be with us live, but he has prepared a recording for us. Thank you.
Hello, I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination. I regret I'm not able to attend in person today because I'm on travel status, returning from Cairo, Egypt, where I was part of a World Hepatitis Day event. But I wanted to provide a video message because I feel very strongly about the work that you're going to be hearing about today. As you'll hear, over the last 6 to 8 months, we've been working with local civil society organizations to raise awareness regarding the benefits of hepatitis B birth dose vaccination and seeking to provide that information to clinicians, policymakers, and the public to help everyone realize the benefits of hepatitis B birth dose vaccination that can promote policy change so that this birth dose vaccine can be reliably delivered to all newborns, preferably within the 24 hours of life. Now, in Africa, this hepatitis B vaccine is tremendously important. The burden of hepatitis B is high, including among pregnant women. If a newborn becomes infected with hepatitis B virus, they have about a 90% risk of remaining chronically infected and being at risk of that virus causing progressive liver disease till that liver fails, or there's a development of liver cancer. And with that end-stage liver disease, that child, now an adult, there's a 1 in 4 risk of dying prematurely from hepatitis B. That vaccine is the opportunity to prevent that early death from happening. And raising awareness is the first order of business to make that vaccine available. So the work you're going to be hearing about is tremendously important. And I think you'll be impressed by the strategies and approaches that these organizations took on to convey that message in an appropriate and effective way to these target populations. I want to thank the US CDC for their support for our work and for the work of these partners that have made this work possible.
We apologize for the abrupt interruption of that message. But as John was wrapping up, the the program that supports the CSOs and the work that you'll be hearing from is like this from a grant provided by the US CDC. I'll now hand over to Quincy Williams, the Communications and Development Specialist at the Coalition, to introduce the CSOs and moderate the next session of this webinar. Quincy, over to you.
Thank you, Jabril, for the thoughtful introduction to today's webinar. And thank you, Dr. Ward, for your excellent overview of the hepatitis B burden in Africa, the urgent need for timely birth dose vaccination within 24 hours of birth, and the importance of ongoing advocacy and awareness. First, again, we would like to extend a thank you to the U.S. Centers for Disease Control and Prevention for being our project partner and collaborator for this important initiative. So I will give a brief background on this year's project. So I'll first like to say this is our third cohort of the CSO Grants Project. Starting in 2022, so far we have partnered with 18 civil society organizations in Africa from 11 countries, including Uganda, Malawi, Burkina Faso, South Sudan, and Rwanda, just to name a few. So this year's project grantees had full creativity for their project, all while incorporating required activities and tailoring their activities and materials to the target population. So I'll briefly describe those activities and target populations. So first, importantly, we would like for this year's organizations to engage policy leadership. So a key requirement is to organize at least one high-level meeting with the Ministry of Health officials and relevant policymakers. So these meetings are designed to secure their commitment to developing or scaling up national hepatitis B birth dose vaccination policies within their respective countries. Lastly, this engagement is critical for long-term integration and sustainability of Hep B birth dose in national immunization schedules. Next, we ask CSOs to develop tailored communication materials. So each grantee is expected to develop locally relevant educational materials, such as infographics, videos, posters, and audio messaging. So these materials must be in local languages and reflect cultural context to improve public understanding and general political will. And lastly, this goal is to promote both implementation and policy adoption of Hep B birth dose vaccine. Following, we asked CSOs to create a coordinated campaign implementation. So in partnership with local stakeholders, each project must design and implement a coordinated health campaign. Campaigns should raise awareness, build demand, and encourage uptake of the birth dose vaccines among the key populations. And so the target populations will be, of course, political leaders and policymakers, healthcare providers, particularly maternal and child healthcare providers and traditional birth attendants, community leaders and health officials, and lastly, the general public, particularly pregnant persons, women of childbearing ages, and their families. So a last part of their project was to evaluate the impact of health promotion activities. So all projects must include an evaluation component to measure the effectiveness of their health promotion activities. And lastly, feedback from this evaluation informs future strategies and helps ensure that outreach is reaching the intended audience. So next, I will introduce this year's cohort. We had 7 organizations from 6 countries. First, we have Community Vision Group from Cameroon, followed by Hepatitis Foundation of Ghana. Then we have LVCT Health, which is based in Kenya. We have 2 organizations in Nigeria. The first, which is Equal Health and Rights Access Advocacy Initiative, followed by Women in Hepatitis Africa, which are part of the Live Well Initiative. And then we have Supporting Entrepreneurship and Economic Development, also known as SEED, which are based in Sierra Leone. And lastly, we have the Huruma AIDS Concern and Care Team, also known as HACOCA, which is based in Tanzania. So now we'll get started with our spotlight presentations. And I would first like to turn it over to Dr. Gilbert Mickey, who is the founding president and CEO of Community Vision Group. Community Vision Group is a nonprofit organization and member of the Hepatitis Alliance, and they're focusing on hepatitis B advocacy and awareness since 2021. Dr. Gilbert.
Hi, can you enable me to share my screen, please? Okay.
Of course, go ahead. Thank you.
Lovely. Let me put it on slide mode. Okay, hi everyone. Thank you very much for this unique opportunity. I'm Gilbert Mickey, the promoter of Community Vision Group, as Riley introduced. I'm also here at the London School of Hygiene as a research fellow and evidence-based policy advisor. I'll move on to what we've been able to do at the level of Cameroon. Just again, to flag up Community Vision Group, our vision is really to create a transformed community through shared responsibility. And the mission of this organization is to ensure that children grow up with their full potential. And this really sits squarely within the framework of this intervention. We have our real critical areas of focus: school health and nutrition, health service delivery, including hepatitis B, research and training programs really form the foundation of our organization. Now, talking about hepatitis B in Cameroon, it's very important for me to flag up here that the current prevalence rate in Cameroon is not 11.2, had the recent studies now taking it to 12.6, which is really scary at the moment. But the birth dose is still at zero coverage. The priority at the level of Cameroon at the moment is just for mothers who are infected. So they prioritize children of mothers, of infected mothers. So that's the situation at the moment in Cameroon. This is just a slide to show where Cameroon is compared to what is happening at the level of the continent, at the level of the at the global level. So Cameroon still really has something to do, a lot more in terms of the birth dose rollout. Now, moving on, we focus on hepatitis B. What does Community Vision Group really do in addition to this project? We focus on awareness-raising education activities. We carry on screening and vaccination, and then linkage to care and support. And so these are the three areas, strategic directions that we follow in this particular program. Now, talking about the project, which we were really fortunate to be amongst the CSOs that were awarded the opportunity. We're looking at the range of activities. First, organized coordinated campaigns that we did. We signed up partnerships with local radio stations for routine broadcasting of key messages around hepatitis B birth dose. We also organized radio talks, inviting expert guests to speak on this, and particularly in English and in French, given the bicultural nature of the country. We also had the need to develop infographics, produce HepB, those education, education and communication materials. You can see the poster here we developed and printed and put that up at very strategic positions, and also some great t-shirts with some real information about birth dose. And this is just to give a picture of this coordinated campaign, community campaigns that were carried out by the Community Vision Group volunteers across the communities. We carry on, we organize 2 municipal stakeholder meetings, really at the grassroots level. The ambition here is to ensure that we have this hepatitis B birth dose integrated within the council development plans, which are decentralized government structures in Cameroon. We move on with the last main very important activity, which is the National High-Level Advocacy Coordination Workshop. This held on the 25th of July, and this is really an opportunity. We had to bring together the officials of the Ministry of Public Health, and also stretching to the ministry, other ministries like the Ministry of Education, just to make sure that we have concerted effort. We also had policymakers, members of parliament, regional representatives, other CSOs coming on board to see that we all have a joint commitment to support the government in rolling out the birth dose vaccine by 2026. That is when the government of Cameroon is looking to roll out universal birth dose. Now, just moving on in terms of partnerships, we're able to build so much excellent partnership with the EPI team, the Expanded Program for Immunization, the Department of Health Promotion, all at the Ministry of Public Health. And we're looking at the level of implementation. We build partnerships with collaborations with the municipal councils, the radio stations, And then we have an ongoing initiative with the Clinton Access Initiative, just to see how we can really form a formidable team to carry on with this intervention. And this is just to show our engagement with the EPI team in Cameroon, presenting the project and letting them understand what plans are in the pipeline to carry this forward. And this is just to flag up to say, these are some of the partnerships we'll be able to roll out, the evidence that we've been able to do this along with them. And what are really the next steps? The next steps here is definitely for us to look at how to continue integrating, enforcing the integration of hepatitis B birth dose into the council development plans, and continue the engagement of government ministries to take this forward and also improve the awareness. So all of these are things that we're looking at as the potential successes that we've already been able to get. But in terms of the next steps, we want to continue engaging far beyond this project, continue engaging the population, finalize the policy briefs in order to share with policymakers, engage with Gavi to see if we can access CSO funding for immunization coverage, and continue to engage members of parliament as such. So this is just a snapshot of the wonderful team that has been working with me on ground to realize all of this. This is just a cross-section. There's so many of them. I just want to give a shout out to them who are listening to this presentation, and a big thank you to the organizers and the sponsors of this event. Thank you very much.
Thank you, Dr. Mickey, with an impressive team and impressive activities. Thank you so much. We look forward to Cameroon's next steps. We will now hear from Mr. Richard Laria from Hepatitis Foundation of Ghana. He is the Secretary of the Hepatitis Foundation of Ghana, which is a nonprofit organization based in Accra, Ghana. So Richard, please feel free to go ahead and start your presentation.
Good afternoon, everyone. Thank you for having me here. My name is Richard Niemolai with the Hepatitis Foundation of Ghana. So we'll begin with a brief introduction of what the foundation do, what we are about. Next slide, please. Next slide. The Hepatitis Foundation of Ghana was founded in 2007, registered in 2008 as a patient-led, patient-driven organization. What we do is to seek to promote the awareness of the prevalence and incidence of viral hepatitis in Ghana. Our vision is to eliminate new viral hepatitis infection and also improve the quality of health for individuals living with hepatitis in Ghana. We do this by establishing a uniform and a fair approach when it comes to managing hepatitis issues in Ghana. We also serve as a primary source of information for people and families affected and infected with viral hepatitis in Ghana. Since our establishment, we've had several engagements with the Ministry of Health, the Ghana Health Service, into the development of the national policy and then the treatment guidelines. Next slide, please. Yes. So the foundation basically is a volunteer-led organization with no paid staff. It consists of members who have level experience with viral hepatitis. And we are very much transparent in all that we do. We accept responsibilities for whatever actions, individual and collective, which may be. Next slide, please. Next slide, yes.
If I advance it, it might be a slow, just a lag.
Okay, thank you, Quincy. So since 2007, the Hepatitis Foundation has been involved in so many activities in Ghana. We've collaborated with the Ministry of Health and the Ghana Health Service in the establishment of a national viral hepatitis control program for which the first substantive program manager was appointed in 2012. We advocated for the development of a national policy on hepatitis and also participated in the launching of the policy in 2014. Every year, we take part in the celebration of the World Hepatitis Day. We are actively involved in training for community health nurses, health professionals, and hepatitis patients. We also provide free screening and vaccination to the general public, give supportive care and prompt referrals for hepatitis patients. Our president is a member of the National Viral Hepatitis Technical Working Group in Ghana. And the foundation was also involved in the hepatitis evaluations to amplify testing and screening and treatment projects in Ghana by the Coalition for Global Hepatitis Elimination not too long ago. Next slide, please. So, on our birth dose program, the current status is that WHO recommended universal infant immunization for HBV incorporation into the extended EPI for all countries, especially in Africa, in 1991. However, Ghana had a delayed response to this call, only adopted the HBV vaccination in EPI in 2002. Currently, what we do is infants born receive the birth dose vaccine at 6 weeks, 10 weeks, and 14 weeks, not at birth and within 24 hours. So it was important to express that the 2004 National Policy on Viral Hepatitis recommended that all infants born to hepatitis B positive mothers should be given the HepB vaccine and the immunoglobulin. This was in a way to prevent mother-to-child transmission, and also provide universal access to HepB vaccination for all children from 0 to 11 months, including all births receiving the birth dose vaccine within the National Immunization Program. It's important to understand that the key point to this is early vaccination, which is crucial for protecting infants from potential HBV infections. Next slide, please. Next slide.
It's gone to the next slide.
Good. So our project involved 3 key activities. First, to organize a high-level stakeholder awareness and support for HBV birth dose in Ghana. We had this event on the 23rd of April, co-hosted with the Ghana Health Service. Target group included Ministry of Health, the Ghana Health Service, National Health Insurance Authority, health professionals, NGOs in health, prison services, and other organizations. The next was to ensure that we develop a national birth dose implementation plan. Plans had been far advanced, but unfortunately, because we had a recent change in government, the dates for the meeting has stalled a bit, but we are still working hard to keep this going. And then finally, to improve public awareness on the benefits of HepB birth dose. We did this by producing and distributing advocacy materials, organizing radio and media campaigns, organizing community forums, so that we can disseminate information on prevention to mother-to-child transmission. Next slide, please. Next slide. So these are samples of the IEC materials we used, and then pictures from our stakeholders meeting. Next slide, please. Yes, these are also organizations and government institutions we've identified to help us with this partnership. So we are looking at the Ministry of Health, the Ghana Health Service, Other implementation partners include the Ghana Registered Nurses and Midwives Association, the Ghana Association for the Study of Liver Diseases, and then other key institutions too. Next slide. On our next step, there's a communication tool developed that is okay, sorry.
Thank you so much, Richard. That's a great presentation. I think we're at time, but we see the next steps on the screen, and we'll make sure to circulate in the chat the additional notes you have on the next slide on other next steps included too. And the slides will be posted as well. Excellent work, and thank you so much. I'll hand it back to Quincy.
Thank you, Lindsay, and thank you, Richard, for an excellent overview of Hepatitis Foundation of Ghana's project this year. We will now hear from LVCT Health, represented by Dr. Cleophas Ondieki and Mr. Duke Sangara. LVCT Health is a Kenyan non-governmental organization formed in 2022, dedicated to facilitating universal access to equitable and integrated health services for vulnerable, marginalized, and at-risk populations. So Dr. Ondieki and Mr. Sangara, please feel free to come ahead.
Thank you very much, Quincy, for the introduction. So my name is Cleophas Ondieki. I'll be presenting on behalf of LVCT Health about some of the insights and successes that we've learned next. So LVCT Health is a Kenyan NGO that was registered in 2002, and we are dedicated to facilitating universal access to equitable and integrated health services for vulnerable, marginalized, and at-risk populations. We have our headquarters in Nairobi with 13 regional offices, and we support projects in 35 out of 47 counties in Kenya, mainly through support from the US government. And we provide technical expertise and through South learning. And we've supported 11 countries in West Africa, known as Ivory Coast, plus and the rest is mainly in Southern Africa, to develop national HIV policy documents mainly. And we lead in designing and implementing innovative health programs in the areas of HIV, sexual reproductive health, maternal child health, gender-based violence, mental health, viral hepatitis, and health systems strengthening. Our website is, of course, lvcthealth.org. Next. These are some of the objectives for this advocacy campaign that we did, and it was to increase the awareness on the benefits of birth dose hepatitis B vaccination among the pregnant women, their families, healthcare workers, and the general public and policymakers in Kenya, and also to facilitate the introduction and scale up of routine universal hepatitis B birth dose vaccination in Kenya. To establish and sustain a coalition of civil service organizations and stakeholders to continuously advocate for hepatitis B birth dose vaccination and elimination of viral hepatitis B among children in Kenya. And just to mention that the birth dose vaccination is already in the Kenyan policy, but it is not in our extended EPI or extended program for immunization schedule. Next. So some of the updates is that the Kenya National Immunization Policy Guidelines for 2023 support the introduction of birth dose hepatitis vaccination. And then, of course, we do not have the NITAG recommendation, or it's not included in the schedule, the KP schedule. But some private hospitals actually do provide birth dose hepatitis B, mainly the high-end private hospitals. The first dose of hepatitis B in Kenya is given at 6 weeks and as part of the pentavalent series. So at 6, 10 and 14 weeks, which is of course very late for the prevention of the perinatal transmission. And then hepatitis B has been included now in the revised 2025 integrated guidelines on HIV viral hepatitis and STIs that's set to be launched in September. And the Ministry of Health, through the National AIDS and STIs Control Program, has finalized a policy brief to support the NITAG recommendation request, which is actually sitting in the Director General of Health's desk. He's also started going through it, and he's actually the lead technical advisor to the Minister for Health on all matters health. So that is the stage at which we are at. Next. So an overview of some of the project activities that we've done is that we met with the head of the National AIDS and STI Control Program, together with the manager for the viral hepatitis and the STIs, so that we could gain the buy-in to drive the agenda, and that is a photo showing that, which we did in April of 2025. We got buy-in from this group, and it's the group that we mainly have been dealing with. We opted to go the way of the National AIDS and STI Control Program rather than working through the National Vaccines and Immunization Program, because Kenya is a signatory to the triple elimination agenda for HIV, hepatitis B, and syphilis. So it was easier to gain a buy-in this way than through the vaccines program. Next. And we also participated in a 5-day workshop which will develop the integrated guidelines on HIV and viral hepatitis. And in this, we managed to gain the inclusion of hepatitis B birth dose introduction. And we are represented in this workshop by Duke, who is also participating here in this webinar. Thank you. Next. These are some of the pictograph in some of the activities that we participated in, and we convened a meeting between the Ministry of Health and stakeholders to discuss the triple elimination of HIV, hepatitis B, and syphilis, and the birth dose hepatitis B vaccination was also included in this agenda. Next. These are some of the IEC materials that we developed for this agenda, both targeting health workers and the community who are beneficiaries. We haven't fully rolled this out to the community as they await the launch in September, where we'll now help in the printing and the dissemination of some of these materials. Next. Some of the partnerships that we managed to gain during these activities were with the National AIDS and STI Control Program, the National Vaccines and Immunization Program, the Kenya Pediatric Association, where we had collaborative engagements to fast-track discussions to introduce hepatitis B birth dose. And this will mainly work especially for the private hospitals that are not already giving the birth dose vaccinations. The Kenya Pediatric Association is it's a major group of all pediatricians in Kenya that can help in rolling this out. We also had a partnership with the Health NGOs Network, which helped in provision of immunization advocacy to support hepatitis B birth dose introduction. And of course, the KENITAG, where we actually were scheduled to meet tomorrow, but unfortunately the members canceled last minute because they were commemorating the World Hepatitis B Day yesterday at Coastal Town, which is quite a bit of distance from where we're supposed to meet. But we've rescheduled the meeting and we'll communicate the dates as soon as we're able to get them. Next. Steps and the impact is that for the successes, we got buy-in from the MOH officials. We managed to support NASCOP to develop a policy brief. We put to MOH a request for the KENITAG recommendation, built a CSO front for advocacy, and then of course the commemoration that we had yesterday. And the next steps is to incorporate now the hepatitis B birth dose deliberations within the triple elimination consultancy that we are also again leading through CDC Kenya. And then we are finalizing the integrated HIV and viral hepatitis and STIs guideline for 2025. And then we are continuing to support the National Immunization Technical Working Group and Viral Hepatitis and STIs Technical Working Group. Just to mention this next. Just to mention that a challenge that we faced as Kenya as a country, and when we're having this discussion, is that we actually on the accelerated transition phase from Gavi, because Kenya is classified as a low middle income country, and because of this we are ineligible. We actually classified as a middle income country, so we are ineligible for Gavi support. And one of the things that we are seeing hesitancy from the government perspective is who's going to pay for the vaccines once we transition out of Gavi, and that is one of the major challenges that we faced. Of course, and also being cognizant of the fact that we've also faced some acute shortages here and there of some birth dose vaccines, together with a not so great uptake of the birth dose vaccines of BCG and oral polio. So those are some of the challenges that we've been addressing together with government and seeing on domestic resourcing of the purchases of these vaccines. Thank you.
Thank you, Dr. Ondieki and the entire LVCT Health team. That is a wonderful project, and we're excited that the Hep B birth dose is included in the revised guidelines that is expected to be launched in September. So following, we will hear from Mr. James Egahi, who is the Executive Director of Equal Health and Rights Access Advocacy Initiative based in Kwara State, Nigeria. Mr. James.
Thank you very much. Partnering effectively to promote hepatitis B birth dose through Results and Learning Project, Kwara State, Nigeria. And it's a pleasure to be part of this, and thank you for the support of the Global Hepatitis Elimination. So our organization, Equal Health and Right Access Advocacy Initiative, location of our organization, we implement both in North Central Nigeria and Southwest Nigeria. And the main objective of our work is to, and program focus in Nigeria is to promote awareness among political leaders, healthcare providers, community leaders, pregnant women, and the general public about the importance of timely birth dose vaccination and to prevent mother-to-child transmission, and also to contribute towards creating an effective advocacy platform that supports the adoption of a key policy mandating universal HepB-BD vaccination within 24 hours, starting from Kwara State, Nigeria as a focal point, and to facilitate the rollout, scale-up of the hepatitis B birth dose in Kwara State, Nigeria, and also by engaging local healthcare workers and establishing effective referral pathways and training of healthcare workers to ensure newborn receive timely dosage. Next slide. So despite the WHO's call to action and the recent Gavi decision to ensure continued support for the implementation of HepB-BD vaccination in Nigeria, there's still a little bit of a lack of awareness and inadequate structure to support the timely delivery of the vaccine in Nigeria, especially in rural areas or areas that have poor infrastructural development. Further, also, the National Technical Working Group has identified the importance of the HepB-BD vaccination. The National Vaccination Policy mandating the universal implementation is yet to be fully adopted practically in all states and community level, which has contributed to coverage a bit far less in its implementation target. Our 6-month program, advocacy program, has been implemented through the support of CGHE in Kwara State and has helped rejig efforts of once docile platform in the last few years. Currently, the Federal Ministry of Health and Social Welfare, with all its sub-agencies, have now started alignment with the viral hepatitis elimination strategy recommended by WHO by reviewing process towards political will or political support plans towards effective implementation of the integrated triple elimination of HIV, hepatitis B, syphilis among neonatals in Nigeria. Our work is coming at the nick of time and puts Kwara State especially as one of the 4 pilot states in Nigeria, which is very great. And that has brought about the inauguration of the State Technical Working Group on Hepatitis Elimination, which Equal Health and Right Access has now been officially inaugurated to be part of. Next slide. So we are engaging in continued high-level advocacy with government structures and sub-agencies towards creating an enabling environment with policy support and effective implementation of the hepatitis B birth dose at both urban and rural settings in Kwara State, Nigeria. We have ensured by strengthening, monitoring practical knowledge capacity of healthcare workers in primary healthcare settings on administration of the timely hepatitis B birth dose periodically. We have also ensured continuous sensitization and active involvement of community-based actors, youth, women leaders, traditional birth home personnel or attendants, organizations, and local district leaders towards supporting timely referral and ensuring collaboration with primary healthcare settings in the elimination of hepatitis B among neonatals at community level, effective use of monitoring and evaluation tools towards gathering timely data for improved decision-making in our HepB-BD policy development advocacy with stakeholders in their diversities in Kwara, participatory development of IC materials that involve healthcare workers community of women living with hepatitis and other women within childbearing age are very key towards helping us to shape understanding of HepB birth dose information in both English and local language, building close working relationship, and influencing integration of timely HepB birth dose referral support during implementation by Global Fund support partners. So we've been able to build a partnership with some Global Fund supported grant partners in the States. Those are organizations that are carrying out community work, and we are trying to integrate the HepB birth dose administration or interventions into their work, which they have gladly accepted to partner with us. So we have overview of few pictures here. I think we had a lot, but it could not have accommodated all. So we have our IC materials at the fourth stage there. The IC materials then, the IC materials is printed, translated in 2 extra languages, which was the support of community of women living with hepatitis and also other key beneficiaries within childbearing age. They supported us in the translation of Yoruba and Hausa language, which is very predominant in Kwara, aside English language. And also our second pictorial role is talking about the community forum, which we help to engage in our HepB-BD education, advocacy, community needs assessment. So you can see a picture there where we had a lot of community work with key personnel, especially local leaders, birth attendants, homes, and also other communities of women living with hepatitis and those within childbearing age. And the third is pictorial illustration of healthcare providers. We provided capacity development, strengthening, and monitoring of what they are going to be doing in the field, and also to bridge the gap in the delay of administration of the 24-hour birth dose among traditional birth attendants and healthcare worker setting. Next slide. Our partnerships. Okay, yeah, I've moved there. I've moved beyond that. So our partnerships, where we have built the partnership with the lead agency of health in the state, which is the Kwara State government, the Kwara State Ministry of Health, through the Director, Department of Public Health, and all other sub-agencies. We have also built partnership with them. We have also gotten their memorandum and their buy-in to support the process and also support policy development, both now and in the future. The Kwara State Primary Healthcare Development Agency, the Kwara State AIDS STI Control Program, KWASCAP, the Kwara State Immunization Department, domicile under the Kwara State and Primary Healthcare Agency, and also the Kwara State Technical Working Group on Hepatitis Elimination. Also, we have also ensured women representation in our work. The Kwara State Ministry of Women Affairs are also currently helping us to promote findings, field-based information towards contributing to the draft HepB birth dose policy we are already developing to be presented to this technical working group on hepatitis elimination in the state. That is one of the great platforms we are using to be able to promote, ensure that policies are already being developed, and also the governor or the political person, the political actors should be able to have a buy-in. So our next slide as an organization, after partnership, next slides. Next steps and impact. Yes, in the last 6 months, we've ensured improved community engagement platform with grassroots stakeholders in Kwara State to drive testing services for women, to ensure that women uptake adult vaccination if they are negative, or if they are positive, engage in treatment, and to ensure that the hepatitis B/D birth dose for neonatal is also achieved, uptaking and also ensuring timely completion. Also, we've contributed to knowledge enhancement of over 100 primary healthcare workers, which has improved timely provision, and also follow up on this process, because for trainings we carried out in the pilot local government areas of Kayama, Edu, Ilorin East, and the Patigi area, we ensure we train and we ensure we follow up knowledge assessment and practical activities happening in the field. Also, the community forum of women, we also engaged them. They help us shape our knowledge, knowledge of leaders who in turn supported us to co-create the IEC materials, and we printed and also distributed over 3,000 copies to end users and stakeholders in Kwara. We successfully received approval towards contributing our quota by supporting the state TWG elimination, state TWG group.
Mr. James, I'm so sorry. Please wrap up if you can. We're at time.
Okay. Yeah, also through the community forum, we have ensured community-led research tools to generate evidence. We've done that through our community capacity and interface with community persons. We use research tools to gain information for our program development, and also been able to carry out community assessment of selected traditional birth attendance suits allotted in our pilot LGA to help us to generate baseline data on the scope and coverage of the current implementation in the states. Lastly, we have a 36-month work plan, next step and impact, 36-month work plan. So we are ensuring that the Kwara State Ministry of Health, the sub-agencies, will be working closely to them to sustain the effectiveness of our work, contribute our quota to the State Technical Working Group, which is the #1 body in the state that is involved in policy development and shaping. We are going to be part of it, and we are supporting the process. Also, we are providing organizational leadership in monitoring and evaluation of the current areas we are working. Now, we are going to be expanding to the other areas in the state, that is extra 11 local government, and also conducting community-led monitoring exercise across 16 LGAs in the state. That is part of things we'll be doing in the future, and it might be the first CLM exercise in Nigeria and hepatitis, which we look forward to help support structures, support information, and support service delivery of hepatitis B birth dose in the states, Kwara, and also possibly an extension Nigeria. Thank you.
Thank you, Mr. James. This is such an impressive project, and your full presentation, including your next steps and impact, will be available online. So moving forward, representing Women in Hepatitis Africa, we will now hear from Dr. Bissy Bright, who is the first Vice Chair and Chief Executive Officer of Women in Hepatitis Africa, which is a woman-led public health organization and part of the Live Well initiative based in Lagos, Nigeria. Dr. Bright, please go ahead. Be on mute if you are talking, but please let us know if you would like for us to return back to your presentation.
Yes, hello, thank you. Yes, please,
Awesome.
I'll be happy. Yes, I'll be happy if you can kindly share the slides, conduct the presentation for us.
Okay.
Thank you very much. So good morning, good afternoon, good evening, everyone. It's a privilege to be here. We want to thank the Global Hepatitis Coalition for the opportunity to share this work. And we also want to thank the Task Force for Global Health. Thank you. I'll quickly talk about the organization, the Women in Hepatitis Africa. It's an organ of the Live Well initiative and a full voting member of the World Hepatitis Alliance. It's headquartered in Lagos, Nigeria, but it has representatives in at least over 6 other African countries. And the main objective of our work in Nigeria and in Africa is to enhance the race towards the elimination of viral hepatitis by the year 2030 through the women of Africa joining hands to eliminate viral hepatitis. And the primary focus of our work is on advocacy, awareness creation, screening, vaccination, linkages to care, and training of women all over Africa as hepatitis champions. We actually run the only women's organization for hepatitis in the continent of Africa. And we inaugurated the first PMTCT in hepatitis syndicate session in 2017 under the watch of the Federal Ministry of Health and the WHO. We have actually trained over 5,000 women all over Africa from 18 African countries as hepatitis champions, including over 100 women who've never been to school. And we have also trained masters and doctoral candidates from Harvard University in different types of hepatitis practicums. We also introduced artificial intelligence, blockchain, and digital technology into hepatitis vaccination in Nigeria in the year 2024, which was last year. Next slide, please. Thank you. So talking of the updates of the hepatitis B policy, here in Nigeria, the federal government of Nigeria adopted the hepatitis B birth dose vaccination policy a few years ago, and there is a lot of work ongoing. The government is already implementing. However, we have found as a CSO that those key points which government is emphasizing for the implementation are points that we also are trying to use. Some of these points I've listed here, I'm going to save on time, but we look at introducing financial incentives, strengthening national policy for vaccination tracking, using rural infrastructures like town hall meetings, radio programs, etc., etc. And these are the things that we have done in this project. Next slide, please. So if you look at the overview of the project activities we have run 15 different programs in the past 6 months, of which we started off with the development of communication materials. We developed and got approval from the coalition for 6 to 7 different communication materials. We held 3 town hall meetings. I'll mention some of the villages where we went: Okun Alfa, Igbo Efon, Ibule Soro cluster of villages, Owode Shogun Road, and so on. And then we also went on to 2 other communities to run big community health outreaches: Okun Alfa, Ologolo villages, and Ireti-Ayo village. We also, apart from these outreaches, during the outreaches, we actually incentivized the attendees, the pregnant women. We distributed mother and baby packs and gave them, we made sure that we provided snacks, food, light lunch for the people. We developed radio jingles. We actually formulated a song for hepatitis. And I will sing that anthem before I finish speaking. It's a very short one that can be sung anywhere in the world, in any language. We translated it to the Yoruba language and Pidgin, and we call it the hepatitis anthem. We also, among the radio jingles we developed, we imputed the hepatitis anthem in the jingle and then put some messages along with that. And among the activities, we also had our technical team, which went on the ground and did some surveillance here and there. And we were able to run some interviews in the radio stations. We worked with the government. So our work was done both from the bottom within the community, bottoms up, and we also had a top-down policy where we worked with the people at the National Primary Healthcare Development Agency, the executive secretary level. At the state level, we worked with the permanent secretary of health and the primary healthcare coordinators in all the 4 states in which we worked. We had 3 different webinars, 2 webinars with the top government functionaries, one of which was actually held at a radio station with the radio people. We also had a radio interview and review. And then we had 1 webinar that was strictly for just the top government functionaries alone. And then they came in and spoke about the uptake of the hepatitis B birth dose vaccination. So we did work with very top government functionaries. And then we did a lot of social media feeds. We were posting online to make sure that the world could see what we're doing. And we went on to do a feedback mechanism to find out what was happening, what was the impact of this work. We also held focus group discussions after we had trained hepatitis champions in the communities. And one key thing was that the hepatitis champions we trained, most of them were traditional birth attendants, many of whom had never even heard about viral hepatitis. And you see the literacy level, we have very high levels of low literacy in the community, and many of these people patronize the traditional birth attendants. So getting the traditional birth attendants to be trained as hepatitis champions became a very key issue in the impact and outcome of this program. So next slide, please. We just want to share here some of the pictures. This was the Ibule Soro Town Hall, and you can see we used placards. Among the materials, communication materials, we had placards, posters, banners. You can see even the backdrops. We had giant backdrops. You can see the nurses, the matrons, the officer in charge. At the basic health centers, we worked with the officers in charge. And in the local governments, we worked with the primary healthcare coordinators. You can see pregnant women at the bottom here holding their mother and baby packs for their babies. Next slide, please. Next slide, please. Okay, this is another one at the town hall, Ologolo. And then if you look at the other project activities, the ones that distinguished us, you know, the placards, the backdrops, they were really different. And then the hepatitis anthem, I think I'll sing it very quickly now. It's a very short anthem that just says, hepatitis B vaccine, my baby needs it, your baby needs it. HepB-BD, HepB-BD, your baby needs it all, my baby needs it all. HepB-BD. In Yoruba, HepB-BD, HepB-BD. Ó dára fọ́mọ mi, ó dára fọ́mọ ẹ. HepB-BD. We also had some unique social media feeds, and then the focus group discussions made the communities get engaged, especially after we had trained the hepatitis champions within the communities. The community members were happy to come out, the pregnant women, the TBAs, the community members, to talk about the uptake. And everybody now became part of a vigilante group that was watching out for making sure that people took up the vaccine. Next slide, please. We were able to—
You're right, if you could kindly wrap up, we're at time. It's wonderful. The song was excellent.
Oh, sorry, I didn't get that.
We're at time. If you could kindly wrap up. The song was lovely.
Okay then, thank you. Okay, I'll just round up very quickly. So these two pictures, we can see here how we trained the hepatitis champions. We had even syndicate sessions for them. Next slide. And then the partnerships, we partnered with government as well as other implementation partners. Among the government,
I think we might have lost Dr. Bright, but we will move forward on with the next presentation. And of course, as always, these slides will be available upon the end of the webinar. Next, we'll hear from Mr. Mohammed Salia of Supporting Entrepreneurship and Economic Development, also known as SEED, of Sierra Leone, who will share their work engaging policymakers and using media campaigns to boost HepB-BD vaccine access, awareness, and demand. Mr. Salia, please go ahead.
Thank you very much, Quincy, for having me. It's a great opportunity to be here, everyone. To share with you, we have had a very positive 7-month journey. So we are here to share about our experience and also to learn from you. Thank you very much. So next slide, please. I'm Mohammed Salia. I'm the Executive Director for SEED Sierra Leone. So SEED Sierra Leone is a local non-governmental organization operating in the southern part of Sierra Leone, and our main objective is to advocate for empowerment and improve the socio-economic and health status of marginalized communities. As many of you might be aware, Sierra Leone does not currently have a formal national policy for administering HepB, but the government has made a very powerful plan in 2025. We want to see how they can vaccinate 355,000 newborn and also distribute more than 457,000 doses of vaccine, which will be given to infants within the next 24 hours of birth. Next slide, please. Next slide.
It's advanced to the next slide. It might be a little delay.
Okay. So do I continue?
Can you see it? Did it move to the next one, the overview?
No, not yet. But I can still continue talking on that.
Yes, you may still continue. Yes, go ahead.
Okay. So basically, our project has been to enhance access and uptake of HepB vaccination. It's a community policy approach for pregnant women and healthcare workers, policy-driven approach. So we must understand that the goal is not only about the vaccine being available, it's even the access. Are people having access to this vaccine? Do they know? Are healthcare workers trained for this? So we are looking basically about community, how they can access it. And over the last 7 months, we have been opportune to be supported by the coalition to work on a project where we ensure that this happens. So first of all, we are producing and airing hepatitis B jingle. So we are also producing soap operas, that is like radio dramas, where we educate newborns how to access the vaccine and to also understand the urgency of this. We have also organized a national conference of pediatricians and other health professionals to update them on the recent WHO systems and also the treatment procedures for this. And we are also partnering with government hospitals and private hospitals to also start educating newborn, doing antenatal clinics on the importance of HepB. We also convene a policy meetings of some lawmakers and healthcare officials to tell them about the urgency of bringing this vaccination into our national health policy. So if you can see to the next slide. Okay, Quincy, you are there now. So if you see to the next slide, the national conference where we bring together the pediatricians. Okay, this is, yeah, okay. Sorry. Okay, so we bring together lawmakers to explain to them about the urgency of this vaccination, because what we understand as an organization, they are given priority to a lot of disease outbreaks. Most times people think hepatitis B is a joke, but it's not a joke. It can wipe out a whole generation. Even the lawmakers does not believe that this vaccine at some point is very serious. So we are coming to them, explaining the urgency of this vaccine. For the first time when we have this type of collaborative meeting, they have seen the urgency of this vaccine. And even with newborn mothers, they have no idea about this. They do not ensure. Some of them, when they give care at a peripheral health unit, this is not an important criteria. But we are telling them that this is a very important criteria to ensure that your baby is being vaccinated against this Hep B. Yeah, next slide, please. This is okay. So is this the last slide you have just shown?
This is the government partners. If you want to talk about your partnership development.
Yeah, okay. Okay, the government slide partnership. So at the moment, as we speak, with the help of the coalition, we have also been able to establish partnership with the National Coordinating Office for Hep B. And together we are coming out with a big launch of Hep B campaign in January 2026, where we bring all partners together. The new strategic plan have already been developed so that we cannot work in isolation. The problem we have at community level and even at national level is organizations working in isolation. So now the National Coordinating Office want to see that we all come together under one umbrella. So we work together as a team, and we are also supporting this process. We are currently in the process of developing a concept note where we work around the launch of the campaign. Yeah, and for implementing partners, we have been working with the Bow Children's Hospital. The doctor who has been in charge is here, probably listening to this webinar. And also, we have also worked with the government hospital and the Care and Care Hospital to ensure that they increase together a very robust vaccination during their antenatal process, because the challenge we have is the referral pathways. Yeah. So the next slide, please. Okay. So one success we have been able to develop an MOU, which is a communique, where all of the health partners we have worked with have just committed to ensuring that the screening process effectively works at their healthcare facilities. Why this happens, you need to understand that the challenge many health facilities have, like I said before, they are not even including this in their daily screening process. So we now want to ensure that they include this into their next daily screening processes. So, which is very key doing antenatal clinics, which is very key. And for our next step, we are looking forward now to working with the ministry to develop a concept note of a national-wide launch of the hepatitis B program, where we include more partners to come on board. And we have also based on field level assessments. This is very important. I say this because we closed, that like I said in the beginning, it's not only about making the vaccine available, but ensuring that the beneficiaries access the vaccine. This is very crucial. I can give you an experience from Sierra Leone where we have had vaccines that have remained at some point even expired because those vaccines have not been accessed by the beneficiaries. They are at the district health management team, and because they have the capacity to skip these vaccines. So now, many of these health centers, people do not come here to access this. So our next step is to ensure how pregnant women, young mothers can know that this vaccine is at the correct center and they can access it from there, which is very, very important for us in the next phase. This is what we want to embark on and also work with the government. Yeah, okay, Quincy. Thank you very much.
Thank you so much, Mr. Salia. That was such an impressive project. We are going to now move on to our final Spotlight CSO project, and that is going to come from Mr. Pancras Molamila of Hirama AIDS Concern and Care in Tanzania, also known as the HACOCA team. They will share its work with government partners to build support for hepatitis B birth dose introduction and raise public awareness about its benefits for newborns. Mr. Molamila, you may now present. All right, I think we will circle back to Mr. Molamila's presentation with the HACOCA team. So we will now move forward to our perspectives from our panelists. Our first presenter for our perspectives panelists, we'll have Dr. Stephen Saucer, who is head of vaccines at Gavi Vaccine Alliance.
Hi, Quincy, can you hear me okay?
Yes, I can hear you okay. Please let me know if you would like for me to advance your slides or if you would like to present your own.
If you're able to only have several slides, right? But if you're able to advance them for me, that would be great.
Yes.
It's coming up. Yeah, it's there. It's there.
Okay, perfect.
Great. Okay. Let's thanks, Quincy, thank you for advancing the slides. And let me just take the opportunity to thank the organizers for inviting Gavi to participate in this panel discussion. So I have a few slides, but what I'd like to do is try to bring everyone up to speed with Gavi's hepatitis B birth dose program. I think some people in the call may be familiar with it, so it's a little bit of level setting, but I'll try to run everyone through how this has evolved over the years. I think many people understand that Gavi has long supported hepatitis B immunization since 2000, really, helping to vaccinate more than 760 million children through 2023. In 2018, the Gavi board provided an approval to invest in hepatitis B birth dose. And implementation at that time was meant to begin in 2021. Of course, at that time, other things occurred. We were also impacted by the COVID-19 pandemic, and subsequently there were decisions to delay the implementation as well as the design of the program. That again was meant to start around the same time as the pandemic. What transpired in essence was that there was a delay. The program was initially launched in 2024, following another Gavi board decision to unpause the program. And so since July 2024, we've had a hepatitis B birth dose program as part of the 20 vaccines or so that Gavi supports countries with. Next slide, please. Actually, sorry, I wasn't paying attention, but yeah, let's move to the program overview. Great. So here, what I'd like to do is just provide a little bit of a 50,000-foot view of the program. So Gavi's hepatitis B birth dose program has a few key components, and what I'll do is just walk you through these. So, really in line with WHO recommendations, all infants, regardless of birth weight or gestational age, should receive their first dose of hepatitis B birth dose as soon as possible after birth. As you all know, this needs to be early, ideally within the first 24 hours. And it's this timely birth dose that's critical to preventing mother-to-child transmission of hepatitis B virus. Gavi also offers comprehensive support as part of this program for eligible countries. So what this means is that Gavi provides procurement for the vaccines, as well as the injection material. So those supplies that are necessary to help obviously deliver the vaccines. Also, sharp waste boxes to make sure that we manage that appropriately. Gavi also provides introduction grants. We call them vaccine introduction grants, or VIGs. Here, it's really a one-time support to the country to help them to try to defray, if you will, some of the costs of introducing a new vaccine into their primary healthcare system. And through the Alliance, again, not speaking about the Secretariat where I work, but the Alliance, WHO, UNICEF, and other partners, we provide technical assistance to support countries to develop strong applications so that they can be reviewed successfully and approved, as well as technical assistance to be able to ensure that those introductions are of quality and introduced safely. Third, the eligibility here is different than for other programs. So countries that are Gavi eligible and have not yet introduced hepatitis B birth dose are eligible for Gavi support. Additionally, countries that introduced the vaccine after the December 2018 Gavi board decision, such as Ethiopia, Rwanda, and Uganda, these countries also are eligible and have subsequently received approval and support to introduce the vaccine. Or I should say they've already introduced the vaccine, so that support helps them to continue with the scale up of that vaccine. Finally, there are some key considerations to help to ensure that implementation is successful. So while some of these may vary by country and context, we do believe that these are important to ensure, again, successful implementation. And so here, what I'm referring to is, really trying to ensure that countries focus on that coordination and integration with maternal, newborn, and child health services, as well as other relevant programs. Routine immunization is an obvious one, but there are some countries where hepatitis B birth dose, again, kind of runs in parallel at times to routine EPI, given when and how it's delivered, as well as other connections to be made in countries where it's been found to be helpful, or aligning with hepatitis control units and clearly antenatal care support that exists in countries. The other piece that, again, this community knows is really important is strengthening the community health systems that operate in country contexts. Obviously, this is essential to help ensure, as the previous speaker was talking about, real access to the vaccine and uptake. This is how we will ensure sustainability and overall effectiveness of our programs. And again, to the degree necessary, be able to help to try to reach those births that take place outside of the formal health facilities. Next slide, please. So on this slide, let me just lay out how, in essence, to read it. So on the left-hand side, we have 54 Gavi-eligible countries. Of the 54 Gavi-eligible countries, 34 technically qualify for Gavi's support. And among these, 30 are from the African continent. So of those 34 eligible countries, 12 countries have already submitted an application to Gavi and have been reviewed by the Independent Review Committee and have been approved for support. The first country introduction is awaited, so it's scheduled to take place in Eritrea in September 2025. Based on our forecast and the intelligence that we have from countries and in collaboration with our partners, we understand that there will be 5 more introductions that are expected in the first quarter of 2026. And there are 6 remaining countries that have approvals in hand, and they're currently in the preparatory stages for introduction. Some of them in 2026, later in the year. And I believe that Guinea-Bissau is scheduled to introduce in 2028. Next slide, please. So this slide, and I'll just preface it by saying it's a bit dense, but what I'd like to do is walk you through how Gavi's evolving approach to vaccine prioritization and the support for applications is being considered and will shift as we move into our next strategic period beginning in 2026. Now, this isn't necessarily specific for hepatitis B birth dose, but again, I think it's important to lay this out for this community, and we'll speak to a couple of specific points at the end that are specific for the community. First, related to vaccine prioritization. Now, there was a SAGE session back in March of this year that encouraged countries to take ownership of their vaccine introduction strategies. Really, the key message that came out of that SAGE session is that each country should be empowered to make its own informed decisions on the prioritization and timing of new vaccine introductions. These decisions should be systematic and country-led, not influenced by others, but also should take into account the national context and be obviously country-led and country-owned. Importantly, prioritization should be aligned with another initiative that is being supported in countries, and that is national immunization strategies. So NIS is for short. These are, again, the plans, these multi-year plans that countries need to use as their game plan as they move forward with their ambitions for new vaccine introductions, but also program optimization. Often, NISs are part of a broader sector strategy. So both the NIS and the broader health sector strategy should be reviewed and updated. Really, ideally, NISs are looked at as being, live sorts of documents that can move and be shaped by maybe some of the changing context and needs at the country level. Next, moving to what we're calling more holistic, if you will, Gavi support. Historically, countries could apply to Gavi when we opened a support window, and that their applications, it's actually the previous slide, please, still on the previous slide. Applications would be considered in a standalone format, right? We are moving though to try to make this more of a holistic and comprehensive exercise. So applications and the planning on the countryside is now taking place in what's called a full portfolio planning, or FPP process. And Gavi is also working on revising this process to ensure that it's not only holistic but multi-year and can align with the country's national immunization strategy. And that is the country developed and country-owned document. And we're trying to ensure that our holistic application can align and really be fed into as much as possible from the national immunization strategy. This updated approach is expected to be finalized by the end of this year, again, as we move into our next strategic period from January 2026. And the goal is, again, not to further complicate or overcomplicate things, but it's really to try to be better coordinated and efficient in how we support sustainable programs. And this is particularly important as the number of available vaccines grows, and the decision-making process for countries around what to introduce, what not to introduce becomes ever more complex. And then finally, the last point on this slide, and again, I apologize because I know that it was a bit dense, but I do want to highlight a couple of what I think are, kind of specific implications for the hepatitis B community. So stakeholders that are involved in hepatitis B birth dose have the opportunity to take advantage of both some training that will be out there related to vaccine prioritization and product optimization. This is referred to in shorthand as VPOP. There are some WHO AFRO-led webinars that are being scheduled. And again, this is for people to be able to profit across the vaccine landscape. It's not particular to one particular vaccine, but it does take into account that countries will be making decisions, sometimes tough decisions, across the landscape of available vaccines. So if there is an opportunity to participate in these trainings, I would encourage you to do that. There are also opportunities to actively participate in national level discussions on that prioritization of vaccines. And if you are from the hepatitis community and you have the opportunity to participate, please do, because this is a way to be able to advocate for the value of the vaccine, and hopefully again be able to put this up on the priority list that countries have related to other new vaccine introductions that may also be tabled for discussion. And then, of course, there are NITAGs and other national bodies where NITAGs need to be appraised of hepatitis B birth dose, right? And they need to understand, yes, the opportunities, yes, the challenges, but really also the value for money that this vaccine offers to national immunization programs and primary healthcare programs alike. So together, let's say that all of these actions will help ensure that hepatitis B birth dose can continue to be a priority within national immunization agendas, even when the agenda is long and varied, and there's always going to be, other vaccines that maybe other advocates want to introduce. I have one last slide, and I'll make sure that it's quick. It's really just on Gavi's current hepatitis B learning agenda. So in general, when Gavi approves a new program, we try to ensure that we also have some financing, some ability to invest in vaccine-specific learning agendas, really with the aim to try to ensure that investments are as effective, efficient, and evidence-based as possible. So specific to hepatitis B, we've designed a learning agenda really around trying to explore innovative strategies for delivery, understanding that different contexts in different countries require different strategies and sometimes thinking out of the box. So here we're looking at assessing the role of community health systems and trying to understand from different stakeholders in countries their perspectives of how we can improve access to and delivery of vaccines. Our two primary objectives, out of this work are really to identify those promising models that can help hepatitis B birth dose coverage increase and bring it up to target levels that countries set out in their programs. And then secondly, to generate and share evidence that supports global and country level advocacy for delivery innovation. Lessons from other countries are often adaptable and can be used in other countries, and being able to document this and share is important, as I think everyone in this webinar understands. So we have some targeted countries that are being supported for this work. These include Ethiopia, Uganda, the Gambia, and Nigeria. We're engaged a bit more deeply in Ethiopia and Uganda, where hepatitis B birth dose is already being used. And then in Gambia and Nigeria, we're taking a slightly lighter touch approach, if you will, and we'll be trying to learn as much as possible from their ongoing implementation experiences. Together, again, these efforts will help us try to shape more effective guidance that we provide to countries in terms of how they leverage Gavi resources, and hopefully, again, will result in scalable vaccine delivery models across the continent and elsewhere for countries to take advantage of those lessons learned. So with that, again, I'd like to thank you for the opportunity, and I'll turn it back to you. Thank you.
Thank you so much, Dr. Salasler, and thank you for participating in this webinar. I do want to take a quick break from our panel discussion and turn it back over to the Human AIDS Concern and Care group to present their final spotlight. So, Mr. Molamila, if you are back online, we are ready for you. I will go back to your slides.
Thank you, and I'm sorry for earlier challenge on the voice. Yeah, I'm Pancras Victor. I'm presenting on behalf of HACOCA, based in Morogoro, Tanzania. Next slide, please. Next slide, please. Yeah, Human AIDS Concern and Care, abbreviated as HACOCA, is located in Morogoro, Tanzania, and we have programs that are being implemented in Morogoro region, in Mwanza, Geita, and Dodoma. And the organizational main objective is to improve the well-being of children, youth, and women through areas such as health promotion, education development, economic empowerment, and gender-based violence prevention. So about hepatitis B dose updates in Tanzania. At policy level, Tanzania has advanced the hepatitis B dose vaccine preparations. And here I mean that there's some strategic plans and the guidelines emphasizing birth dose within 24 hours in place. But also the Minister of Health is currently finalizing preparations and also assessing logistics and evaluating sustainability before launching the hepatitis B birth dose program. And also, the Minister of Health is actually waiting for the government to approve and to secure support from Gavi. It means here it means that what actually is the government is doing is that they're just doing some logistics to ensure that once the program has been introduced, it's going to be sustainable, and then they are going to consult Gavi for support. Next slide. So generally, that in Tanzania, Tanzania has not yet introduced the HepB-BD within 24 hours. So with this project, HACOCA was actually advocating, trying to influence policymakers and decision makers to ensure that they increase public awareness on the benefit of hepatitis B dose for newborns. So as I mentioned, as we were actually doing advocacy to influence since the hepatitis B dose is not yet implemented, and we had like some activities that we actually implemented. We had advocacy consultation meeting with the Minister of Health, President's Office, Regional Administration, local government in Tanzania. And the aim was actually to increase awareness on the need for hepatitis B based vaccine, but also to secure support. So generally, during the meeting, at the high-level meeting with the two ministries, they actually indicated commitment and the urgency of introducing the hepatitis B dose in our country. Next slide. Next slide, please.
This is the next slide. It's a slight delay.
Thank you. Thank you. Along with the advocates, we also developed IEC materials. And here we developed like 500 evidence-based brochures and leaflets to support high-level advocacy messaging. And this actually helped to effectively communicate key facts and the urgency for introduction of the hepatitis B dose in our country. And as you can see, that is one of the IEC material brochures. And they were both in the Kiswahili language and the English language. Another activity was what we did was advocacy meeting with the National Immunization Technical Advisory Group, NITAG, to seek support for their influence, because these are actually very potential partners. And so we had like a couple of meetings. During the meetings, we were informed that the NITAG had already recommended to the government the need for urgent introduction of the HepB-BD dose. It was also learned that the Ministry of Health had developed monitoring and evaluation tools that would support once the program has introduced. Next slide. So we also had, I think I've mentioned about this. Please, can you go to another slide? So in terms of collaboration and partnership, we had partners like the Ministry of Health, the IVD members, the NITAG members, and unfortunately we did not have implementing partners because as we were doing like advocacy. With a few partners like the NASHCOP, the National AIDS, STI and Hepatitis Control Program, we had no implementing partner during our advocacy work. Next, please. So talking about the next steps and impact. Since the country has not yet introduced the hepatitis B, but though, we think that we actually need to continue advocating by engaging other partners, including the NITAG, but also to sustain momentum by partnering with other stakeholders, raising awareness and aligning with the existing maternal and the newborns program. But also will be like during pursuing integration and the potential funding from donors in order to support hepatitis B and BD introduction efforts in Tanzania. So far, we note some notable impacts. One is that our work successfully brought the issue of hepatitis B dose to the attention of the country. And also, during our work, we played a key role in national advocacy, building stakeholder support and laying essential groundwork for future implementation. But also, for us, we look this as an impact because we've been able to establish partnership with the task force for the global health and the coalition for hepatitis B. Yeah. Next. I think that in the end, thank you very much.
Yes, thank you so much, Mr. Molamia, and I'm so sorry for the technical mishap earlier, but an excellent presentation, and I would like to extend a warm thank you for all of the CSOs this project year. You've all had an impressive project, and you have worked so hard towards your country's impacts and next steps. So I will return back to the panel discussion, our perspectives from partners, and so we're now going to have a presentation from Ms. Sophia Knudsen. She is a research officer from PATH, and so I will quickly go to her slides. One moment.
Oh, and I'm happy to share, Quincy. I figured out my IT issues.
Okay, that works well. Thank you so much.
Perfect. Okay, perfect. Awesome. Well, thanks everybody for your interest in our session today. My name is Sophie Knudsen, and I would like to first and foremost thank our coalition for the opportunity to present. I'll be sharing just a quick overview of a scoping review that my colleagues and I did to share how birth dose vaccines are delivered during home births and how these lessons can help with the hepatitis B introduction in other countries. So PATH, with the support of Gavi, like you heard from Dr. Stephen, is working on a learning agenda to improve timely hepatitis B birth dose delivery, especially for babies born outside of health facilities. Our work has 3 phases. The first was a global scoping review of strategies, and then we now are in phase 2, where there are case studies based on desk research, interviews, focus group discussions, and there will be co-creation workshops planned in Ethiopia and Uganda later this year. And the third phase is our implementation research to test which of these strategies work. But today's focus for the presentation will be just on phase 1, which global strategies exist to reach newborns at home within the first 24 hours. But before getting into the scoping review, I wanted to highlight why reaching babies born at home is so important. Facility-based strategies often miss these newborns, and delays in vaccination can make it less effective. And globally, 28% of births happen at home, but in some countries, it's as high as 78%, which means that we need strategies that work outside of health facilities to ensure timely protection and move closer to hepatitis B elimination. For our scoping review, we looked at how birth dose vaccines are delivered to babies born outside health facilities in low and middle income countries. We explored what strategies have been used, the successes, the challenges, the lessons learned, and how vaccine delivery is managed in those settings. Today, I'll focus just on the first question: what strategies have been used to reach babies born at home? Our eligibility criteria included only birth dose vaccines delivered within 24 hours at home in the low and middle income countries. Literature searches were conducted in PubMed and selected Global Health Organization websites, and there were 2 reviewers independently screening titles, abstracts, and full text for eligible sources. And our data extraction followed a standardized form, and findings were summarized using descriptive statistics and thematic analyses. A total of 26 studies published between 2005 and 2025 were included in our review, and these came from several WHO regions, mostly Africa and the Western Pacific. And most of our studies focused on hepatitis B birth dose vaccine, with some also looking at BCG and oral polio. And this is where I'm going to spend most of our time today, these next 2 slides. But we found 2 main approaches to delivering the birth dose vaccines for home births: bringing newborns to the facility or vaccinating them at home. And you can see this in that red box in the center of the slide. While some strategies support families to reach the facilities to get that vaccination, most focus on vaccinating newborns at home. And this includes outreach from health workers, training community providers to vaccinate, and using out of cold chain storage to improve access in remote areas. Some cross-cutting strategies played a role in vaccine administration, like tracking home births, which is in that purple box on the left side of the screen, and educating or incentivizing families and providers in that blue box on the right. Because our primary focus for governments tend to be increasing facility births and vaccinations there, reaching babies born at home remains a gap. And so next we'll focus on 2 key home birth strategies for vaccine delivery from the review. And that includes training community health workers to vaccinate and using out of cold chain storage. So first, facility-based providers like doctors or nurses, and even midwives in some cases, typically administer birth dose vaccines only at the health facilities, which limits access for babies born at home. To bridge this gap, some countries are training community health workers to vaccinate during home visits, which most of the studies in our review described community health worker roles as supporting access through referrals or education. But one study from China trained them to vaccinate at home, and other global resources are showing growing interest in this approach. These providers need vaccines that they can safely store and carry without refrigeration. And so the hepatitis B birth dose vaccine, being relatively heat stable, has been used off-label and out of cold chain with evidence of safety and effectiveness. While out of cold chain storage is used in Africa for other vaccines, none of the studies in our review showed that it was being used for birth dose vaccines or in home birth contexts. However, studies from 5 Western Pacific countries show it improved access, coverage, and timeliness. And then compact pre-filled auto-dissable devices, or CPADs for short, offer a packaging solution that makes vaccine administration safer and easier for providers with limited training. So together, training the community providers, using out of cold chain storage, and leveraging CPADs can help ensure more newborns get a timely birth dose vaccine, no matter where they're born. Our scoping review provided a broad landscape of strategies for delivering birth dose vaccines outside of health facilities. And to complement this, we're conducting those case studies in 4 different countries to understand how these strategies play out in different health system contexts. As you've heard earlier from Dr. Stephen, Uganda and Ethiopia are gearing up for national introduction later this year of the birth dose, while Nigeria and Gambia offer insights from years of implementation, which is helping us capture both emerging and established approaches. In Uganda and Ethiopia, we're also holding human-centered design workshops to co-create practical, locally tailored strategies with key stakeholders. And together, these insights can support countries introducing or scaling up timely birth dose delivery and strengthen approaches for reaching the triple elimination goals by 2030. That's all that I have for us today, but thank you for your interest in today's session. And I'd also like to thank our steering committee for your guidance and to Gabby for your support in funding this research. And if there's any questions, we'll have that Q&A session, but feel free to follow up via email with me and my colleagues here. Thank you.
Thank you so much, Sophie. An excellent presentation as always. If there are any questions and you would like to put them in the chat, please feel free to do so and we'll try our best to answer them there as well as at the end. I am going to turn it over to our last panel discussion presentation from Ms. Malungo Luvoye, and she is a part of the Center for International Health, Education, and Biosecurity of Zambia, and she will be talking about the promotion of hepatitis B vaccination for healthcare workers in Zambia. So, Ms. Malungo, you have the floor.
Thank you so much, Quincy, and good morning, good afternoon, good evening, everyone. I will be talking about the hepatitis B vaccination for healthcare workers that we have actually rolled out in Zambia starting around October 2024. We can move on. Okay, that's just an overview of the presentation. We can move. Thank you. Okay, so as introduced, I'm part of CHEP Zambia, and We have quite a number of projects within the organization, but of course, for this meeting, I'll focus on the healthcare worker integration project that is being supported by the Task Force for Global Health. Next. Okay, so for the Zambia Healthcare Worker Integration Project, where we have a combination of hepatitis B and influenza that has been introduced for the healthcare workers, we are targeting 12 districts within the country. And from the map there, we can see that the districts that are shaded in blue are the ones that are targeted for this healthcare worker vaccination. So in terms of our selection criteria for these 12 districts, we did do a desk review to actually look at the cases of suspected and viral hepatitis cases from 2019 to 2023. We did get that from our Public Health Institute. And then we also looked at districts that had influenza sentinel surveillance sites, because we are also integrating this hepatitis B vaccination with influenza vaccine administration. And then, of course, we needed representation of an urban versus rural divide, and to ensure equity, as we are learning lessons from this demonstration project. And of course, because we had a limited number of vaccines that were available to us, we also did make consideration for the number of healthcare workers that are within these districts. So this will be implemented up to 2027, and we are hoping to learn lessons that will actually enable us to inform policy towards an introduction of the hepatitis B vaccine as part of the recommended vaccines for healthcare workers. Next. So what have been our key successes and the project updates so far? We did have the initiation and the national stakeholders engagement meeting, as well as conducted readiness assessment back in October 2024 when we just started. And then we went ahead to conduct a cascade of engagement meetings right from the sub-national level to the facilities that were eventually targeted. And then I think between April and March and April, we actually did conduct a behavior and social drivers of vaccination survey, where we actually wanted just to get insights that would inform our implementation in terms of what the behavior and attitudes, as well as knowledge, is amongst our healthcare workers on hepatitis B, as well as influenza and COVID-19. So we have actually disseminated these results and have really learned quite a number of lessons towards which are actually going to be used as we roll out our healthcare worker program. And we've also managed to train over 485 staff within these targeted 12 districts. And I'm glad to say this month we've actually launched the vaccination program across the 12 targeted districts. Next. Okay, so just some highlights in terms of what feedback we've received from the different stakeholders that we've engaged, right from the national and sub-national level. We've had tremendous appreciation for the project. Of course, we know that hepatitis B amongst our healthcare workers has been largely on demand, and it's quite expensive out of pocket. And I think this has come as a great opportunity for healthcare workers to receive it within their facilities. And of course, there was a call for us to have sharing experiences with other countries implementing similar projects. And of course, the importance of equity and sustainability post this demonstration project. And I think there was a strong call for us to include the volunteer staff and community-based volunteers, as year one of this project is largely just going to target the permanently employed healthcare workers within these 12 districts. And of course, I think what was earlier recommended is that we have a single dose vial for both the hepatitis B and the flu vaccines. And of course, I think a key challenge that is across multiple EPI programs is an issues of cold chain and backup power. So I think considerations to support backup power as well as cold chain. Next. we've gone ahead to create some job aids and IEC materials highlighting some of the key, which are actually being informed by the BESD survey. And we have started working on these, and these are to be shared with our healthcare workers across the 12 districts. Next. And here in pictures are just some of the photos from some of the launches that we've had across the 12 districts. And that's our one of our provincial health directors getting their vaccine in dollar. So this is just the demand that was created during the launches that we've held across the 12 districts. Next. Okay, so in terms of implementation at facility level, the first district started vaccinating on 10th of July when they held their launch. And really, I think the guidance that we gave during the trainings and orientations was that we would have a campaign-like style approach where we would want the health workers to efficiently reach the health workers within their health facilities over a period of 2 weeks, so that the follow-up doses are almost due within the same period, and staff are able to be followed up for the second and third doses at a time where we have quite a number of people that are due. So this is the team composition that is that has been formed on the ground. And just on the right there, you can see some photos of the facilities that are actually tracking their coverage across the days that they're actually implementing. So this was part of our technical supportive supervision visits that we carried out last week, and we were just helping the officers on the ground to really come up with strategies to reach their targets, as well as just help them in terms of how they track their coverage as they do their activities. Next. So also at facility level, this is actually the flow that they've created. We have a separate screening space where they're actually testing for hepatitis B, and then another room or another space is then dedicated for the actual vaccination. Of course, this is to ensure that we have the counseling as well as the testing that is done in one room to ensure confidentiality, and then of course the vaccination is done in a separate space. So other facilities also have the registration space where they're actually documenting the information of the healthcare workers. So we are using the DHIS2 platform that we are using to track the information that is coming for the vaccination data, as well as the commodities that are being utilized within the facilities. So some have actually created outdoor spaces, as you have seen, and this is where they're actually carrying out the vaccination for our health workers. So this is one of our nursing officers actually reviewing the data with the facility level staff in the DHIS2 tracker in Livingstone. Next. So for the next steps, I think we are continuing to provide support to the districts in terms of data quality assessments to ensure that the data is actually ending up in our online platform. But also, we are also going to ensure that we have SMS reminders that are sent out for second and third doses for the hepatitis B vaccine. And of course, we will have a year one implementation review sometime in September, just to actually look back and see what lessons we are learning from the implementation that has happened so far. And of course, we'll continue supporting the EPI program towards efforts of the introduction of the hepatitis B birth dose. So this is what is happening in Zambia so far, and thank you for this opportunity. Thank you.
Thank you so much for the excellent presentation. And I would also like to thank all of our panel discussion participants, as well as our CSOs for participating in today's webinar. I know we are closely coming up on 12 p.m. Eastern time, and that is the end of our webinar, so we may have to forego our question and answer and discussion part of today's webinar. But if you still have any questions, please feel free to put them in the question and answer section of today's webinar, and we will most definitely try to redirect those questions to the respective person and get those answers back to you. But I would like to extend a big thank you for joining today's webinar, as well as a thank you for the US CDC for being our partners with today's webinar, as well as our projects. I would like to plug in accessing our webinar materials, which includes our full webinar recording, as well as separate presentation recordings and slides will be posted on our webinar webpage. The QR code that is shown here on your screen will take you directly to the page where those materials will be posted. And thank you again for joining today's webinar. We look forward to you joining the next webinar and any other webinars that CGHE will be holding in the future. Thank you again.